Hello everybody, this is Dr. Vinayak. I am just trying to make this video in response to the circular which is released by Telangana State Medical Council. I have graduated PharmD in 2018. Since then, I joined into academics and I teach PharmD students. I am an assistant professor in Foreign University and I am a clinical preceptor in SAG Government Hospital. So, I would like to give some points from my side. As we all know that PharmD student, PharmD graduate completes his or her doctorate degree for 6 years, and in 6 years, PharmD graduate tries to evaluate the prescription and he tries to find the medication errors and he optimizes the therapy. This is the very important role of a clinical pharmacist. The PharmD graduate can recognize the untreated health problems which are seen in hospital, and he can resolve those conditions with appropriate drugs. Every physician has to work along with PharmD doctor because PharmD doctors are expertised in pharmacotherapy. Whenever physician finds any difficulty in managing the patient, in selecting the proper drug, so he or she can take the help of a PharmD graduate because PharmD graduates are very well expertised in selection of proper drugs and proper doses to the particular patient. See, in the hospitals, all medical professionals has to think about this thing. The right dose which is to be given to the right patient at right time, at right dose and at right administration. And when drugs are prescribed to the patient, always clinical pharmacist will try to evaluate the prescription and he always thinks that patient has to be given with very limited drugs for a very limited time, and patient has to be discharged with less medication errors, less drug interactions and less adverse drug reactions. So all the medical professionals feels the same. So what I would like to say is the PharmD graduate, the PharmD doctor can evaluate the prescription and he can optimize the therapy by giving very limited amount of drugs to the patient, and he can save the money of the patient with very limited drugs, and he can easily help the patient to discharge very quickly from the hospital. So this is the main objective of the PharmD graduate. And along with this, that PharmD graduate will try to counsel the patient related to the drugs, related to the disease and also about the lifestyle modification. So every hospital requires a clinical pharmacist who is expertised in pharmacotherapy. I would like to request all the PharmD graduates who are working in hospitals all over India in different states, please stick on to your roles and responsibilities. Just try to evaluate the prescription. You are having a lot of duties like prescription auditing, dosage auditing, administration auditing. So we find a lot of medication errors which can be seen in hospital. So stick on to your roles and responsibilities. We have a clear clinical pharmacist roles and responsibilities in hospital. Some hospitals wants you to work as a duty medical officer, which is unethical. We didn't study for 6 years to perform duty medical officer duties. Our duty is to evaluate prescription and counsel the patient and to optimize therapy. We are not expertised in surgeries. We are not expertised in physician duties like prescribing. Our role is to evaluate the prescription and try to find out medication errors. Stick on to these duties. So I request all the PharmD graduates who are working in different hospitals all over the country to perform the duties of a clinical pharmacist or a clinical pharmacologist. I would like to tell what PharmD graduate studies in the college and what expertise he has, what experience he has to work in hospital. The PharmD graduate, he studies for 6 years, and in 6 years for 5 theory classes, he will study the subjects like human anatomy and physiology in first year, pharmaceutics and different chemistry subjects like pharmaceutical organic chemistry, pharmaceutical inorganic chemistry, and he also studies medicinal chemistry. Along with this, the main core subjects of a PharmD student is he will be studying pharmacology for 3 years. He will study toxicology for 1 year and disease management pharmacotherapy for 3 years. Along with these clinical subjects like pharmacology and therapeutics, the PharmD graduate also studies pharmacognosy, and in 5th year he will be doing a clinical project, and along with that he studies the therapeutic drug monitoring subject and also clinical research. The main difference between a physician and a clinical pharmacist is the physician will prescribe specific drugs to the specific patients for specific diseases, but a clinical pharmacist will evaluate those prescriptions, and he is expertised in clinical pharmacokinetics because he is having a sound knowledge in drug absorption, drug metabolism, drug distribution and excretion. So he can manage those patients and he can minimize the drug-drug interactions, drug-food interactions, adverse drug reactions, and he can optimize those patients. He can optimize the therapy with very limited drugs, with very limited time, and he can save the expenses of the patient. See, there are so many medication errors that can be seen in hospital. Starting from the prescription, we have prescription errors. When it goes to the dispensing, we find dispensing errors. And when it is about to administer, we can find administration errors. And once the drug is administered to the patient, we can find dosage errors. So specific drug, specific dose and specific time should be advised to the patient. So we can find a lot of medication errors. Along with these medication errors, we find a lot of drug related adverse drug reactions, vaccine related adverse drug reactions, food related adverse drug reactions. So all these medication errors and adverse drug reactions can be minimized by a clinical pharmacist if a clinical pharmacist is appointed in every hospital, in every department. As the circular passed by Telangana State Medical Council, we are not against to the circular. As they rightly said, it is unethical for a PharmD graduate to work as a duty medical officer in hospitals. We kindly request all other health authorities, the health ministers and Pharmacy Council of India. We request the higher officials to please create a cadre. Please appoint PharmD graduates in every 30 to 50 bedded hospital, in government hospitals, in ICUs, and in every department. Our main role is to optimize the therapy. We try to work along with the physicians, along with the surgeons to optimize therapy. So we all together can reduce the medication errors and drug related deaths in the hospitals. We also demand the higher authorities to implement Pharmacy Act 2015 so that every hospital should be appointed with a clinical pharmacist. And in this current scenario, it is very important that in every district there must be a drug information center and pharmacy information center. So every drug information center, or we can also start a poison information center. So in every poison information center and drug information center, a clinical pharmacist, a PharmD graduate must be appointed. We request the health authorities to appoint PharmD graduates in National AIDS Control Organizations, in TB clinics, leprosy clinics, and in malaria control centers, community healthcare centers, and in rehabilitation centers. So we are requesting the Telangana State Chief Minister Revanth Reddy sir to consider all these points and take necessary steps for the future of PharmD graduates. In Telangana, we have a lot of Basti hospitals, we have a lot of government hospitals and private hospitals. So we request the higher authorities, health ministers and chief minister to take necessary steps and appoint PharmD graduates in the hospitals for their bright future. Thank you.